million Arizonans depend on access for their health care, but under newly signed federal cuts, close to 400,000 could lose that coverage.
It won't affect just Medicaid patients, it'll affect all patients.
Rural hospitals are expected to be hit hardest by the Medicaid cuts. In Yuma, Onvita Health, the region's main medical provider, serves a population where nearly a quarter of patients rely on Medicaid and about half use Medicare. CEO Robert Trenchel says they don't currently expect to cut services or close clinics, but that could change depending on how the state responds to the funding shortfall.
We don't know exactly what those cuts are going to be yet or how much, but we do know it'll be in the millions of dollars for our organization as well as other hospitals across the state of Arizona.
Some rural hospitals are already operating in the red, according to state healthcare leaders who warn these facilities will be the first to feel the impact of the Medicaid cuts. The Arizona Hospital and Healthcare Association, which represents hospitals statewide, says Medicaid cuts are expected to start in the next year and a half. That's when they anticipate many challenges to begin. Helena Whitney, the association's vice president, says Arizona hospitals could see a loss of $6 billion over the next 7 years.
We are talking about taking away millions of dollars from hospitals every single year. There is no other option except for to cut services and to cut staff.
They're estimating by year 3, half of Arizona's hospitals will be operating in the red because no matter the funding,
when people don't have health insurance, they still show up through the emergency department and hospitals have to treat them. We call that uncompensated care.
While Onvita Health remains optimistic, the reality is they're operating on a tight 2 to 3% margins, with a growing share of medical care already going uncompensated.
But our intent really is to do what we can today to augment the revenue that we do have.
Whitney says without real support for rural hospitals, getting care might soon mean hitting the road instead of heading to your local clinic.
I grew up in Sierra Vista, Arizona. If that hospital had to close some of its services, then the only option is to get in your car and to drive to Tucson. That's about a 2-hour drive.
A reality she says rural families could be forced to face. Reporting in Yuma, Alexandra Rangel, Arizona's Family.